I am Gemma Pfister. I am an executive with Dynamic in the London office, and I am the London Hub Lead. Today I'll be taking you through our approach to partner with this client on creating and delivering a global medical affairs governance roadmap. One of the key challenges the client had was creating a consistent approach to practical steps to enable the country's medical affairs teams to support launches. There was a need to create greater efficiency across the teams, and so they needed a roadmap to really make sure that there was a consistent and repeatable process. From a business culture perspective, one of the things that was really important for this project was to ensure that we as Dynamic were identifying those areas of best practice that already existed across the medical affairs teams in Europe. And we wanted to ensure that we were sharing those best practices. The client had some upcoming launches in one of their key therapeutic areas, and it was critically important for the company to ensure that each of the medical affairs teams and their respective colleagues was able to prepare for and execute on those launches effectively. We wanted to take a very agile approach through our methodology. So we designed this project in a way that enabled us to really upfront identify the critical folks who we needed to speak with. And then from there on, it was very much about us bringing our expertise to designing that draft roadmap and then socializing it with key folks and getting buy-in. The key expected benefits that we identified for affiliates are, first of all, to ensure that there is clear strategic positioning. Secondly, we wanted to make sure that there was both visibility and voice for the affiliates. Thirdly, we wanted to ensure that this was going to be fun. Fourth, this needed to have real local focus, and in particular, we wanted to ensure it could flex and scale irrespective of country, irrespective of market size. There were two key deliverables. The first was a maturity model, and that was across the domains of where were the different markets from a medical perspective regarding key things such as KOL engagement, their generation of data, and their preparedness for launch. The second deliverable was a one-page overview that essentially laid out the key activities and milestones from a medical affairs perspective that spanned from -4 years to launch to +1 year. This again covered some of the critical business activities that the medical affairs function should undertake, with key recommendations on when they should start and when they should be completed by for success. From our follow-on engagement and discussion with clients, we know that our governance roadmap, in particular the recommendation and the framework that we created around launch timings, has really helped them be efficient and also confident in their launch planning. And we hear that their most recent launches have gone very well indeed, certainly better than previous. One of the enduring impacts from our project is a commitment to have an earlier engagement with medical affairs in activities such as data generation and launch planning, and also ensuring that there is a tighter connection or a red thread from global to local overall. I can certainly see how these results could be achieved in other companies, irrespective of size and portfolio or franchise makeup.